in greeting all of you, all the members of the nursing profession gathered here this morning. I want to begin with telling you about Pushpa. Pushpa is a nursing student in the Rajiv Gandhi University of Health Sciences in Bangalore. And she was also, as a student, she was also a member of the National Social Service Scheme. When COVID struck, and you were speaking about COVID, we found ourselves short of hands. And Pushpa was among those who were drafted into duty. This was 2020, the first wave. Pushpa worked for a whole week in the most excruciating and difficult conditions. But then there was a problem. Pushpa refused to stop. The hospital follows a practice of rotating nurses every week. You must be familiar with that. So that the nurses are adequately rested at intervals. Pushpa argued that her patients needed her and she could rest later. At that time, I was the additional chief secretary of Sports and Youth Affairs, which you were mentioning. So I headed the NSS program. So I was closely involved in that period with the Rajiv Gandhi University of Health Sciences. The RGUHS is Karnataka's medical university, health university. And we were coordinating efforts. The NSS and the RGUHS were together working towards COVID relief at that time. So that was how I got introduced to Pushpa. When her seniors were unable to persuade her and convince her, they called me to convince her to take rest. With some difficulty, I managed to persuade Pushpa to take some time off and get some rest. For me, Pushpa epitomizes the essence of nursing. Pushpa epitomizes all of you. In the 6th century BC, Sushruta, who is remembered today as the father of surgery, wrote, "The physician, the patient, the drugs, and the nurse are the 4 feet or padas of medicine upon which the cure depends." It is indeed interesting that the first nursing school in India was established in 250 BC by Acharya Charaka, who is considered one of the principal contributors to the science of Ayurveda. If we look at the chronology of modern nursing in India, we will see that in the mid 1600s, a military hospital in Kolkata, run by the East India Company, had to send for nurses from a hospital in London. About 2 centuries later, in 1865, Florence Nightingale, all of you are familiar with the name, drew up a detailed suggestions on a system of nursing for hospitals in India. Thereby, the foundation was laid. It was her insight that guided the reform of nursing and set new parameters and precedents, creating a model that is still followed all over the world. Her birth anniversary, 12th May, is commemorated as International Nurses Day. Just around the same time in 1867, it is recorded that St. Stephen's Hospital in New Delhi started a 4 years bachelor degree course in nursing, offered by the College of Nursing in Delhi and nearby in Vellore. After India's independence, a master's degree course was started in 1960 at the Rajkumari Amrit Kaur College of Nursing in New Delhi. The nursing profession of India has come a very long way since then. Today, nurses are the largest workforce in the healthcare industry in India. What impresses me most about the nursing profession is the large number of women. I think that tells us that this country has a very bright future. Nursing services and capacity building have expanded considerably since independence, and their roles and responsibilities have multiplied over the years. We are talking about multitasking in the morning. The nursing workforce in India can be an instrument of change through better workforce planning, improvement in education and work environment, and through a constructive process of assessing and addressing the nursing workload. India's healthcare industry today is worth more than $45 billion. We have become a Medicare hub. You go to any hospital, anywhere, you will find some patients from other countries who are waiting in the reception for their treatment. However, the healthcare industry accounts for less than 1% of the global healthcare industry. The strength of nurses in India is currently just zero point 0.8 nurses per 1,000 citizens, and this is comparable to the world average of 3 nurses per 1,000 patients, and therefore it is quite low. To come closer to the world average, our healthcare system would need to add about 2 million more nurses to its numbers. Presently, we are graduating about 1,80,000 trained nurses annually. At this rate, it will possibly take us decades to reach that 2 million figure. Despite this prognosis, there is much that we can do to reform and upgrade our capacity. Nurses in India can definitively participate in strengthening the current nursing framework in the country. As trainers and system innovators, they can do much to develop better methods and educate the communities in which they live and work. I would emphasize that given India's broader national goals in healthcare reform, the nursing fraternity would need to go even further by substantively contributing to policy development and ensuring that it evolves in the right direction, responding to the needs of our diverse communities. I would encourage the nursing community to involve themselves in reviewing and remodeling practices. Be proactive rather than just take what is given to you. Modernize methods and rising to challenges. You must expand your vision and your own role. When we speak of healthcare reform, the use of artificial intelligence is an important component. AI in healthcare offers several benefits, revolutionizing healthcare delivery and improving patient outcomes. Here are some key benefits of AI in healthcare. Improved diagnostics. AI can analyze vast patient data, including medical images, lab results, and patient records, to help diagnose diseases and conditions. Machine learning algorithms can identify patterns and anomalies that may be difficult for healthcare providers to detect, leading to more accurate and timely diagnosis. Next, personalized treatment plans, and this is especially useful for nurses. AI algorithms can analyze patient data and medical literature to create personalized treatment plans based on individual patient characteristics. This allows healthcare providers to tailor treatment to the specific needs of the patients, improving efficacy and reducing the risk of side effects. Predictive analytics. AI can use predictive analytics to identify patients at risk who can develop certain diseases or conditions. And by analyzing patient data and patterns, AI algorithms can detect early warning signs and enable proactive interventions to prevent disease progression and improve patient outcomes. Next, efficient healthcare options. AI can automate routine administrative tasks such as appointment scheduling, billing, data entry, reducing administrative burdens, which must be taking a lot of your time, and freeing times for healthcare providers, including nurses. This increases efficiency and allows healthcare workers to focus more on patient care. Drug discovery and development. AI algorithms can analyze vast amounts of biomedical data and scientific literature to accelerate drug discovery and development. This can help identify potential drug candidates, predict their efficacy, and optimize clinical trial design, ultimately speeding the delivery of new treatments to patients. Remote patient monitoring. AI devices and wearables can continuously monitor patients' vital signs and health data and provide real time information and alerts. This enables remote patient monitoring, early detection of complications, and timely interventions, especially for individuals with chronic conditions. Precision medicine. AI can contribute to advances in precision medicine by analyzing data and identifying genetic markers associated with specific diseases. This knowledge can help guide personalized treatment approaches and improve patient outcomes. Better patient engagement and education. Again, the role of the nurse is very important. Chatbots and AI powered virtual assistants can provide personalized health information, answer common questions, offer patient support. This promotes patient engagement, enables self care management, and increases health literacy. Stepping into the future of healthcare, where superheroes wear white coats and possess the power of artificial intelligence, integrating AI into the health sector will revolutionize how we approach patient care, diagnosis, and treatment. Join us today as we uncover the captivating advantages of AI, propelling the healthcare industry into a new era of smarter care. It is important to note that while AI in healthcare holds great promise, it should complement the expertise of the healthcare providers rather than replace human judgment and decision making. Collaboration between AI systems and healthcare professionals can significantly advance patient care. To allay the suffering and relieve the pain of the patient, let us all follow the tenets of Thiruvalluvar's teaching, which mirrors Sushruta, by the way. Two people far flung from each other speaking the same language. உற்றவன் தீர்ப்பான் மருந்துழை செல்வனொன்று அப்பால் நாள் கூற்றே மருந்து. This was Thiruvalluvar's teaching. Any treatment involves these four orders, the four padas which Sushruta spoke of: the patient, the doctor, the medicine, and the nurse. This is what Thiruvalluvar says. Thank you all very much. Jai Hind. Good luck.